Good afternoon, everybody, and thanks to Forbes for giving me the opportunity to be able to speak here. I don't see my presentation here. Okay, there it is. Thank you. So this morning we had a very interesting program, and I think we saw some topics there that really will collaborate well with what I'm going to say today on unlocking healthcare data. So we made great improvements in healthcare ever since healthcare was defined by the early Greeks. We focus a lot on prevention. We know that screening for breast cancer, screening for colorectal cancer is very important. We know lifestyle modifications. We heard about obesity this morning. We heard about the risks of smoking and the risk of cancer. We know about education, informing our children that it's important to live healthy lives, to sport, to make wise decisions when it comes to alcohol and tobacco. Another big focus in healthcare is, of course, detection, because even though you do prevention, some people will inevitably get sick. You know, there's only so much you can do to prevent. So detection, we focus on minimally invasive procedures with very high accuracy, minimal harm, and easy to implement. For example, in Belgium, where I practice, I'm a medical oncologist by training, we do mammographies every 2 years. It's not the most pleasant examination I've heard from my patients, but it's very efficient in detecting early breast cancer, improving outcomes. Screening for colorectal cancer, cervical swabs in women for cervical cancer. So next to prevention, detection is very important when we talk about healthcare in general. Unfortunately, even though we do prevent and we do detect early, we still have to treat a lot. And I think this is by far the most well-known of all the pillars in healthcare is treatment. We want to cure people, and in order to cure people, we want to collaborate. We want to work together. We need a surgeon. We need a radiation oncologist in my field. We need a medical oncologist, but we also need a pathologist to make the diagnosis. We need a radiologist to look at the imaging. We have to collaborate. And we want to do this with keeping quality of life. You know, it's okay if we treat patients, but if we have to nearly kill them in order to keep them alive with very much long-term side effects, this, of course, is not great. If you ask most patients about healthcare, I think 99% of the people will say, well, it's about treating. It's about treatment of disease. That's healthcare. Only a few people know about detection, and prevention is something when you bring it up, oh, yeah, I've heard about that. But there's one point very, very much missing, and it shouldn't be. It's the use of data. This morning, my colleague cardiologist said, we're looking forward to digitizing everything we have on our patients. We want to have digitized EKGs, ultrasounds. We want to have the lab results, the doctor's notes, the prescription. We want the insurance data all to be digitized. Well, I practice in Belgium. We have that. We have everything digitized. All our pathology is digitized. We have millions and millions of X-rays, of CT scans. We have everything digitized. How can we use that? Why is that helpful? Yeah, of course, if I need to look up an EKG from 6 months ago, I just look on my computer, just click the date, and I have it. So it's convenient. But imagine what we could do with these data. How data could be used to improve patient outcomes in the same order of magnitude like prevention or detection could do. How could we speed up AI development? Everybody here has heard of ChatGPT, but ChatGPT is trained on the internet, and we all know the internet isn't very reliable. ChatGPT has no access to medical records. It has no access to clinical trial data. So ChatGPT, if you ask it, how do I treat prostate cancer? Well, you can operate, you can radiate. Sometimes we give anti-hormonal treatment, but that's it. It doesn't give you the details because it doesn't have the data. So we could also monitor how are we doing. I see my lab results evaluate over 5 years, over 10 years, if everything is properly digitized. We can monitor the risk. Are we doing it right in comparison to other centers? How is our mortality in cardiology? How is our mortality in pediatrics? If you invest 50 million in a pediatric hospital in Romania, you want that hospital to be performing at the top level. You have to monitor it. You have to have the data. And also cost reduction. If you look at the innovation budget allocation, and these are figures from 2022, how is our money being spent when we talk about healthcare? You will see quite some shocking numbers. 60% goes to treatment. Treatment is expensive. Drugs are expensive. X-ray machines are expensive. Linear accelerators are crazy expensive. PET CTs are crazy expensive. Detection, yeah. Prevention, sure. We do some prevention in Belgium. We have mammographies, colonoscopies, cervical cancer. But data use, nobody's working on that. Nobody invests in the data. We all want the data, but we don't want to use it, and we certainly don't want to spend money on it. But if you look at this quote from Bill Gates, the ability to track and manage health data with technology will change medicine profoundly, impacting everything from individual care to health economics. This is a very profound statement. This is not only Bill Gates who feels like this. This is people like Steve Jobs with the Apple Watch, the wearables, recording your heart rate, recording your blood pressure, recording the amount of exercise you do. They all collect that data. They don't collect it for your pleasure. They want that data. Why? Because we can learn from it. Because it helps us move ahead if we use the data. So I started thinking about this a long time ago. And I say, okay, what are the healthcare milestones that we have? If we talk about data, everything is data. The hieroglyphs and the pyramids, that's data. The Dead Sea rolls that we found is data. But medical data, digitally available medical data, it actually started in the 80s. GE Healthcare, Siemens Healthineers, and Agfa pioneered to set out to create the first standard of digital data by the invention of the PACS, which is the digital radiology systems, and DICOM standards. These are very familiar standards if you're working in the medical industry. Then another big step ahead is the emergence of electronic health records. In Belgium, there's no hospital that works on paper. Everything is recorded in a structural way, in a digital way. I'm originally from the Netherlands. I was partially trained in the Netherlands. It's the same. I know it's the same in the United States. And probably here in Bulgaria, most of the people will use electronic healthcare systems. So the data was being transferred from scribbly notes from the doctor's office to a very nicely organized system. Then a major leap forward, the adoption of AI. IBM Watson Health was the first one. The next one was Google DeepMind, trying to evaluate radiology images, finding diagnosis, training large language models. It was just the beginning in 2016, and back then everything was go. There was no regulations, so companies like Google could just reach out to hospitals and say, hey, I want to buy 50 million of your x-rays so we can train our models, and it was all good. But then, in 2018, the European Union decided to take a big AK-47 and shoot himself in the foot. We created a law that is the most fear-inducing law in healthcare. I've studied it extensively with my company. I founded a company 2 years ago. It's a ridiculous law that induces fear into doctors. And doctors are the ones that own the data with the patients. But this law basically states that non-anonymized data or any form of data that can identify a person. So if I have a CT scan of you, in theory, we can reconstruct your body from the CT and we can say, hey, this is John Jones. I recognize that guy. So we cannot share any data out of fear of identification. The law is not enforceable. No company or hospital has ever been convicted for breaching GDPR because no law, not in Belgium, not in Germany, not in Switzerland, nobody knows how to use it. It's incredibly vague, but it hinders our progress immensely. Another great mind said the same. He states indeed that the regulatory frameworks are crippling our progress. By being so strict and so fearful of using the data, we just get paralyzed by this fear because we don't want to break the law. We don't want to suffer reputational damage by being the hospital that leaked 5,000 patient files. It never happens, but still this law made us aware of the fear that it can induce. So when we talk about data, this is from my own hospital. This is data from 2018. My hospital does 30,000 CT scans a year. We do 2,500 PET CTs. We do 200,000 pathology slides, all digitized, with outcomes available, quality of life available. We have radiation plans, we have MRI scans, we have lab results, we have everything in a structured way in our hospital. We do nothing with it. Imagine the loss of information. This is one hospital in a very small country tucked away in northwestern Europe. Imagine this on a European scale. How many CT scans are there being done in Europe? How many are being done in Asia, in India, in America? It's in the hundreds of billions of information points that will not be used out of fear, out of lack of infrastructure to make this happen. How can we get the data out? How can we use it? How can we help our society in addition to prevention, detection, and treatment? Use the data. You have it. We have it stored. The data is urgently needed by companies. For example, Siemens. They make machines, very complex machines to irradiate cancer. It's a manual job. It's tedious. It's error prone. It's not very well reproducible. You get treated differently for the same prostate cancer in India, Australia, or Europe. So the companies are trying to solve this. They say, hey, we need these radiation plans. We need the CT scans of these patients to train our systems to become better. No. Siemens knocked at my door. Can we have your CTs from the prostate? No. Bladder? No. We'll pay you 5 million. Nope. 5 million and 2 PhD students. No, we will never sell it. Why not? GDPR. We're scared. We're not going to take the risk. So we as doctors play a very big role in this, but everybody in this audience should be super aware how crucial this is. So in order to tackle this problem, 2 years ago, I met my co-founder at another startup. We're based in California, in Santa Monica. We thought, wouldn't it be great if we could build this digital platform, super secure, super compliant with GDPR, super compliant with HIPAA, which is the American counterpart. There's ones in Asia too, Japan has one. If we could connect all the doctors that I know from my career, together with my co-founder, Pete Oost, who's a radiation oncologist, why don't we start approaching hospitals? Why don't we build this platform? Make it secure, make it free, make it ethical. We will only use the data for ethical purposes, not to exclude patients from insurance. And we thought this is a brilliant idea. So we founded my company, our company, NewLeaf, with Eli, very close friend of mine, American. Spencer's the CTO. He lives in New York. He was one of the co-founders of Uber, you know, the shared drive. Pete Oost, world-renowned radiation oncologist, very close friend and practices in my institution. So we set out to accelerate medical research on a global scale in any way, shape, or form by making the data available. We build a massive amount of tools that will take out any data that you have, and we focus right now just on imaging because we're a startup, unfortunately. We take out your data that's in your hospital. We fully anonymize it. We have a compliance validation software package. We extract it, and we secure it, upload it to our Google Cloud servers, which are certified to run medical data security. And it works really, really well. It's completely safe. It's completely free. We now partnered up with over 30 hospitals in Europe. We're starting in Asia, and we have 2 hospitals signed up in the United States already. And it takes a lot of time, and it takes about meetings like these to maybe 1 or 2 in the audience think, hey, indeed, my data is of value. Maybe not financially, although it could be, but it will help patients. I think the true innovation in healthcare is not better drugs. Of course it's helpful, but not the way data could be. I think the greatest innovation that lies ahead is building these incredibly powerful AI models running on the latest NVIDIA chips. But as long as we keep our data locked in our hospitals, we are never going to get there. And as long as we're going to rely on humans only to evolve medicine, it's going to take us another 100 years to make that next big step. So I just want to thank you all for listening to my talk. And I just want to give you these 3, which I think are very important take-home messages. Access to healthcare data should be a global priority. This is very underserved in the medical world. My company provides this platform, fully compliant, fosters research, and a whole lot of other free opportunities for your hospitals. And never hide behind the wall of fear, because innovation, it needs bold people. Thank you.